Decolonizing Your Healthcare with Dr. Erica Steele. So, I've really thought about building this and creating this for quite some time. So, I'm really super excited for this journey with you to begin. And really, this journey with myself has began so long ago. And through this process, I will definitely weave in a lot of intricate stories from my life that really magnify some of the different concepts that I'm going to bring forth. The information that I'm going to bring forth has both personal as well as social, historical, and scientific implications. So it has multiple vantage points. So when we're looking at the healthcare system from a very critical lens, we often neglect what we don't want to see or what's not comfortable. And I really encourage you to move past perhaps the spaces of superiority bias or confirmation bias or unconscious bias as we really constructively come together to, in my opinion, dismantle a very dysfunctional and problematic and systemically racist healthcare system. And so it is my goal and my intention to educate really anyone that will listen about the various inadequacies that exist in healthcare. When I think about all of my years in healthcare, in a different side of healthcare, so I chose for my own cultural and scientific reasons to pursue natural and holistic medicine from the beginning. It was a conscious choice that I chose when I recognized that Rockefeller's hand in holistic medicine and further was expressed when I really understood the impact of colonization on my own people's indigenous practices and how much of what I do is deemed as insignificant, is discredited, and oftentimes dismissed. And there is a great amount of disrespect and ridicule that happens and has to happen in order for a pioneer and a founder such as myself to bring this information forward. It has not been without pain, struggle, sacrifice, hardship, and a lot of imperfection that I come to you today, really from a space of understanding and from a deep place of willingness to open up and be vulnerable with the world. It requires a special kind of individual to be able to stand up against this big Goliath of a system that is literally weaved into your everyday life. How you think about natural doctors, holistic doctors is all manufactured, is all what you've been taught by the media, by social media, by other people, and unfortunately by a lot of people who have a lot of vested interest in confusing, watering down, and profiting off of your ignorance. My goal also in this is to empower you and educate you from someone who has developed a sense of mastery in not only my profession, but the practice of integrating both professions successfully. I have had the greatest honor of working with many different specialties over the years, from conventional doctors to other naturopaths to homeopaths to acupuncturists, energy healers, Reiki masters, mediums, shamanic healers, intergenerational healers, you name it, shamans, like just so many amazing healers that bring their craft, that brought their craft so humbly to me. And for all of those that I have worked with over the years, in whatever capacity in my own evolution to get me to this point, I truly thank you. I know that I was not always easy in my healing process. And I know that many of you, as you begin to decolonize your healthcare, will realize that this is all but anything but easy. Facing yourself and integrating and healing from multiple traumas that our healthcare system have afforded us really requires a special amount of focus, concentration, support, discipline, and really, more importantly, education and understanding and follow through. There's a lot of components, and it can be very challenging for a lot of different people. So my goal here is that you walk away with this with a little bit more understanding. Segment 1. When I think about healthcare, I think in terms of statistics. There is a story element of it, which we'll definitely go over, but there's also a statistical piece that I want to go over as well. And these statistics are just absolutely alarming. I first want to prioritize Black and Indigenous populations and making sure that our statistics are heard front and center. So, based off the CDC reporting, which, we take it for what it's worth, that higher the rates of diabetes, 12.1%, and also hypertension among Black adults often is tied to historical neglect and economic disparities. In Indigenous communities, the American and Alaskan Native populations face higher uninsured rates and have very limited access to culturally competent care. In states with large Indigenous populations such as South Dakota and Alaska, healthcare systems are ranked lowest in quality and access for Indigenous patients. Black adults experience notably higher rates of chronic disease, healthcare conditions, and like I said, really 12.1% are diagnosed compared to lower rates among our white or white counterparts. Additionally, Black adults face significantly higher rates of hypertension, heart disease, which is partly attributed to limited access to preventative care and quality health services. Dare I say also a lack of education and mistrust for very good reason, which will continue to validate as time goes on. The health issues that are often linked to historical neglect and economic barriers really come from decades of redlining, employment discrimination, limited healthcare access, having concentrated poverty in predominant Black communities, which in turns overall health outcomes. Also, too, we can talk about the food deserts as well and the lack of access to education about healthy foods and just the affordability in and of itself. Much of these factors are contributed to a continued pattern of underfunding of basic human healthcare rights, healthy food, healthy water, education of how to put these things together, what it means to be asleep. Even just having a little bit of peace in a news cycle would be nice these days. So naturally, we're going to see increased risk, of many chronic illnesses within these communities. Indigenous communities, particularly, again, we referenced, report the highest uninsured, but there's also nearly 20% that remain uninsured, leading to reduced access, again, to these preventative and primary care services. And might I remind, we discussed about culturally incompetent care. There really is none. And I would say for both Black and Indigenous populations, we've been stripped of our healthcare autonomy and our healthcare freedom, and that still continues today. We are shunned and not allowed to practice herbal medicine, at least in the public eye of acceptance. It's demonized and called, it's so funny to me, just basic, like, drink water, make sure that the water is healthy and unfiltered. Or excuse me, filtered, because all of these chemicals, all those chemicals, that's a lot, pitchfork, and then there's this idea of, the food and the herbicides and the GMOs and all of this. And there's nothing wrong with that. Gaslight, and all these people are showing up super sick. And it's a wonder, with the air that we breathe and the mold. I mean, the amount of mold that I've pulled out of people's system and that have absolutely killed people is astonishing. And unfortunately, a lot of it has come down to people just not being aware and not being educated, not knowing how to check their bodies, because they only go to the doctor, if they go to the doctor, once a year. They do their vitals, they get their lecture, they get their scare tactics, and then they get pressured and coerced and they're sent along their way. They're not taught the very basics. And over the course of my career, I mean, geez, I've taught, new moms how to hold their babies. I've taught little kids how to eat. I've taught elderly people how to transition mentally and emotionally, to their end of life days. I've held people's hand when they've taken their last breath. I've reassured moms when they've had vaccine injuries and they're being gaslit, coerced, and pressured. I've been on cases where babies have come out because their moms have literally lived on a fast food chemical-laden diet, and they come out with their skin literally almost peeling off, and they're given steroid after steroid after steroid, and me trying to intervene with hospital systems to prevent that steroid poisoning. Or even people who I've treated with massive steroid poisoning who've been given toxic chemical after toxic chemicals to cover up and mask the deep-seated toxicity and nutrient deficiencies that they had initially. And they can't even walk and move and literally delirious. Or the people that have had parasites and have had it dismissed and gaslit. So now they have iatrogenics so bad and they've been self-treating themselves so bad that now they're dependent upon these crazy cleanses, and there's nothing I can do to convince them to stop stripping their system with them. I have literally been the cleanup crew of medicine for years, 20. And my intrigue started really from an understanding of how these things happen. And I had to really put away everything I thought I knew about healthcare, about health, about people, about medicine. I had to put that all aside, and I had to really listen to people, because people would not be reacting this way if this truly was not a problem. I would not be seeing the things that I've seen, the things that I've heard, the things that I've witnessed, the things that I've experienced in healthcare. I can never unsee. I cannot unhear. And year after year after year, even with COVID, and now Idaho is finally going against the CDC. I have to post it later today. And they're finally rejecting the COVID vaccines. They've had too many reactions. All of these lies to these systems, all of this indoctrination that we've had. But this is nothing new. And so I really want to direct your attention to some information from the medical apartheid. I really encourage you to read this book by Harriet A. Washington. I'm going to reference it because it's really important to understand. People don't often read nowadays, and sometimes these books can be really deep and thought-provoking. And so I really want to break it down into really palatable aspects that perhaps make it a little bit easier for you to comprehend really the impact of historical, social, scientific, again, all of these intersections that I mentioned before. So as we again continue our journey, I want to start with this powerful quote. The United States has a long history of providing segregated and unequal medical care to African Americans, a legacy that leaves scars to this day. This powerful statement from the medical apartheid really looks at this historical lens, and we're going to really get into these injustices plus current statistics. Really, it's been rooted in this practice of segregation and unequal medical care. And I've seen this time and time and time again, almost to the point where the other system levers are being pulled in order to wield power onto Black and brown people. So let me give you an example. I often get called into cases like emergency cases, but they're not truly emergency cases. They're more of, I would say, coercion cases and medical malpractice cases. So this happens a lot with pediatricians and with various different healthcare providers that service children specifically. It can happen with anybody, but I see this mostly with children. They have, I think, a greater leverage when it comes to children. So let's say the child is recommended a treatment that the parent has researched, looked up, is just frankly uncomfortable with. Maybe it's experimental, maybe it's too aggressive, maybe they just want to look at alternative options. The healthcare provider, if they don't agree, they will then threaten and use social services against these good, loving, supportive, kind, well-informed parents who are simply trying to be responsible and do the very best that they can with all the information that they are given and that they learn at the time. The healthcare providers do not do any due diligence in looking up alternatives, educating their patients about alternatives, and frankly, they don't really care. And it's not part of their scope of practice. So there's really no onus on them to practice true informed consent, because true informed consent would allow for alternative solutions. Maybe that's not the solution that conventional practice would want or favor for the patient, but our role as healthcare providers is to be objective. When we begin to wield our power as doctors, as healthcare professionals, against the people that we are there to serve, that creates a betrayal trauma as well as an institutional trauma. And the continual gaslighting and cognitive dissonance that occurs within healthcare when doctors do not know exactly what is going on with the patient and they're unwilling to be honest and communicate that point with their patients. Now that creates iatrogenics and medical trauma, especially if they're using more and more and more aggressive procedures, or they're pressuring for more progressive procedures, invalidating and ignoring and dismissing that patient's hesitancy and lack of understanding. They deem that patient as non-compliant. Other aspects that Washington talks about, and naturally some of those aspects are my, inflection into when I'm quoting aspects of her work, I will bring that forth. But there is an expansion that I want to add to it. Washington describes how Black individuals are often treated as mere clinical material for medical experimentation, noting African American bodies have been available for experimentation in ways that others were not. This exploitation laid the groundwork for persistent distrust in medical institutions, which impacts the health choices of many Black Americans today. So, Black bodies are still being used to this day. Again, the horrors that you can't unsee. I've seen people be pressured into studies. I've seen procedures be upheld. I've seen surgeries be upheld. I've seen medications be upheld. I've seen misdiagnosis. I've seen dismissal of valid symptoms. So many aspects. And these are untold stories, because these are not my stories particularly to tell. Some of these stories I will share simply because they bring about a point, some of which I have had permission. I never use names in any of the points that I make, or years, or any other identifiers. It's more so you can understand the essence of what was going on, and what I understood from witnessing it day in and day out, listening to people, and really trying to, with my public health background, my naturopathic background, my biochemistry background, functional medicine background, psychology background, really pulling on every piece of education that I have, really required me to, to really focus in to help these people, because we're being utilized, whether we can recognize it or not. We're still being utilized to this day, for these clinical studies, whether we like it or not. I distinctly remember when the COVID vaccines were being rolled out, and on television, they hoisted up, this Black woman nurse and gave her the injection, knowing the history of us being used in those practices prior to, white people using these services, if you will. This is a quote from Washington again. Racist assumptions and biases were embedded into the scientific and medical establishment, creating a system that often devalued Black health. So here, Washington analyzes how these biases have been institutionalized, showing that unequal treatment has not been institutional, but actually, incidental, but deliberately structured within medical practices. So, definitely we know that much of this has been calculated, to subjugate and utilize our bodies for the gain, because you can't test ethically on human beings without their knowledge because of Nuremberg. So if you make sure that they are undereducated, but you do it behind their back, then nobody knows, right? So it's like a sleight of the hand technique, which, really is very sad and very unfortunate. So I really wanted to bring about this concept in this segment and really bring home the current healthcare inequalities, specifically in Black and Indigenous communities. In the next segment, I'm going to review other marginalized communities as a whole. And in that segment, we'll roll into that and then continue our show. We have 4 segments, so we'll roll into how colonization currently impacts our modern healthcare system. So definitely tune into that as we really kind of bring it all together. I definitely wanted to include a place for others that are marginalized outside of the Black and Indigenous communities, but just know that that's my prioritization, at least in Decolonize Your Healthcare. And as we establish our themes and roadmaps, which we'll go over in the final segment, we'll map out where we're going with these podcasts so you kind of understand, because this baseline information we're going to build upon, and we're going to really help you to uncover not only the historical roots, but the non-consensual aspects of these, and how it's just really come to a head here in 2024, as we are literally days away from the election, and it really hangs in the balance. We have no idea, where we're going with all of this, but we do know that wherever we're going to God, the God from within. So we'll see you when you come back from this short break. All right. So hopefully you got your water, tea, went to the potty, all of that. So we are now going to talk about marginalized communities for a bit. And so let's talk about women. So we talked about, our women's reproductive health barriers are on the line. I think now we're at, I think the third or fourth death from the impact of Roe v. Wade, which we knew what was coming. And so now doctors are unable to practice their oath to first do no harm. Otherwise, they will be held to very severe standards, lawsuits, license stripped away, public humiliation. That's the mild stuff, jail time, lots of consequences for doctors being doctors and for patients needing care, legitimate care. I think, multiple women, and I apologize for not having those women handy. I'm going to look them up as we look into as we kind of delve deeper into this topic. The gender bias, I just got the headlines. The gender bias, though, we know that women are more likely to have their pain dismissed. 70% of those people with chronic pain are women, yet they often wait longer for diagnoses. So women, we try to kind of tough it out and we try to, make it happen. And we just really, unfortunately neglect ourselves in so many ways. We all, of course, know about Black maternal mortality rates 2 to 3 times higher than white women, and can even be higher than that. And then also what is not often discussed is the funding gaps. Those funding gaps naturally definitely affect women, and just in the sense of that women are so pigeonholed to PCOS, endometriosis, these little boxes where I've seen it in terms of neurological, hormonal component, mold exposures, all sorts of different manifestations of health with women that really, happen gradually over time. And then not even the acceptance of bioidenticals, which really, I think, if a woman needs those types of hormones for whatever reason, that they are available. And so there's just so many different, again, injustices for women. Going into the LGBTQIA, naturally LGBTQ individuals, because of the discrimination, often experience mental health conditions and are 3 times more likely to experience mental health conditions, but naturally, I'm sure, are not able to receive that care. I'm sure it's a privilege for many. And transgender healthcare, around 50% of transgender individuals report being denied gender affirming care. Imagine going to a healthcare provider who is trained to be objective and is trained to, and taken an oath to first do no harm, denying you of care that is going to, in essence, save your life. That is just unconscionable. And 19% have been refused care due to their identity. So, compounding rejection, self-abandonment, social abandonment. I mean, where do we go on? It's like just compound trauma. And remember, in intersectionality, as we go into these, intersections, if you put Black on, being a woman, boom, what do we get? What do we say? 2 to 3 times more likely, right? So being a woman is one kind of notch against your belt, unfortunately, in this system. And then being a Black woman, boom, right? Being, let's say, LGBTQIA, boom. Being trans, boom. And really transgender women are the most at risk. And we talked about briefly the lack of access, the insurance gaps that exist that we definitely, need to be aware of, especially to access hormone therapy and gender affirming surgeries. I know there are lots of people out there who can think and feel what they want. If you do not want hormone therapy or gender affirming surgery, you are free to not get one. You are not being forced in any way to participate in healthcare services. I advocate for informed consent across the board. So I do believe that if you don't want to have your gender reassigned, you are not forced against your will. Lordy, I even just slow flashback of one of Donald Trump's ridiculous statements about, children going to school and, having procedures done. Just, it's like an upside down land. And speaking of an upside down land, where our conventional healthcare system was designed to be all things to all people is in fact not, with medical errors accounting for the third leading cause of death. I know a lot of people want to banter with me about statistics on that in the YouTube stratosphere, but hopefully you appreciated my response to that. Lots of complexity to these numbers, but let's just go with simplicity and generalization right now, shall we? We'll expand upon this later. 250,000 deaths per year. And again, contributing factors, communication breakdowns, poorly coordinated care and complex treatment plans, disparities for marginalized communities, also at higher risk because of systemic biases and language barriers. And even, I dare I say, just cultural barriers in general, lack of education, lack of cultural education and cultural intelligence, a lack of emotional intelligence in healthcare. I cannot tell you how many tantruming, emotionally unintelligent doctors I've had to navigate healthcare with patients with and tiptoe around their very fragile egos and, very harmful when we cannot be objective and we cannot truly see the forest from the trees, so they say. Medical malpractice, of course, is going to be on the flip side of that. So this would be the intersection of fuck around and find out. Malpractice costs the U.S. healthcare system billions annually, with claims disproportionately involving people from marginalized groups due to insufficient care. So with all of this amazing spending and all of these amazing advancements, people are still not getting adequate care. It's still breaking down and it's costing a fortune. So when I say, that the healthcare system is just collapsing, like, this is not coming from my own, joy. It's coming from a deep place of wanting to protect people and wanting to take it slow with people because we've been lied to, bamboozled, mistreated, and I want to really hold your hand through this process so that you can understand, how these situations have occurred. So when we're looking at the history of malpractice or discrimination, it really contributes to the diminished trust in medical providers amongst marginalized communities. And this perception comes with objective finding. I mean, look at Tuskegee, look at Henrietta Lacks, look at, all of these, individuals and what's going on. Medical injuries. Now, I will definitely share candidly about these different components because unfortunately, in our culture, when patients speak out and discuss medical injuries, they're vilified. They're told that it's in their head. But imagine being told by that in the doctor's office. And imagine being pressured even still to continue to participate and being shamed and, just the links that I've seen healthcare professionals go to is just, when I share them, you'll notice it's just not rational. It's just not rational. You can tell their unconscious bias is absolutely getting in their way, which is why I've been contracted and consulted on a lot of cases to be that medical oversight. And I know people don't like people over their shoulder, but this patient's voice is not being heard. They can be injured. They have a certain way that they want to treat, either culturally or just in an informed way. I don't expect, every patient that comes to me is not like gung ho holistic medicine, woo, woo, woo. Like I have many patients that are frequent flyers in the ER every other week. I have patients that still get their flu shots every year. I have patients that, think conventional medicine still is a gold standard. And I also have those that would never, like, would step foot, and, you know, that we, review advanced medical directives and things of that regard with patients. And I've stood as advanced medical directives for patients just to protect their healthcare rights. I've had many patients say, I don't only trust you. And that's because we build a patient trust relationship, because I'm genuinely listening and I genuinely want to get to the bottom of it. And I'm not biased in any way as to what the bottom is. I've even had people from my own field come to me for, reviews because they've had issues either legally or otherwise. And I've had to tell them the honest truth about the harms that they've caused. So I really, I've been on both sides of the world. And really, it's just about advocating for the people, because a lot of times medical injuries are underreported and undertreated, especially in minority backgrounds, because their injuries may be overlooked or ignored, especially in emergency settings. And then the biggest problem is just a lack of understanding or education. Individuals with disabilities, low income patients, racial minorities also are going to face higher rates of medical injuries, especially during hospital stays. I often advocate you have to have a healthcare advocate when you're in a healthcare setting, especially if you're going to be sedated for any length of time, because the amount of errors I've seen in that, in terms of doctors changing orders without consulting patients, doctors mistakenly putting orders in that were not patients, nurses serving orders that were not correct from the doctor. I mean, there's all kinds of different combinations of this that I have seen. Like, it's just, pick a struggle. And, it's sad. So it's sad for those that are not privileged enough to have a support system and a family. And I've done work on, going in, because I was a concierge doctor for many years. And, I'd be contracted to go in to visit elderly parents and, work with them and make sure that their diets were balanced and their supplements were good, and make sure, they were still cognitively moving, and even though they had all these things, with the facilities, just touching base and making sure that, one other set of person, to look at them from a different angle. And really that's all it is holistic medicine is very much about the angle of things and the intersectionality. So there's been a lot of people that have been greatly harmed in the medical system. And this phenomenon is known as iatrogenics, or medical trauma, which is harm that's caused by the healthcare system itself, whether that's with adverse drug reactions, hospital-acquired infections, unnecessary surgeries, being gaslit consistently, pressured into healthcare that you don't agree with, all kinds of different things. Elderly populations are naturally most at risk. People with chronic conditions, the frequent flyers all the time that are going to the doctor a lot because they're not getting the answers that they need, and they're being shuffled around from specialist to specialist and prescribed multiple things. I've seen a lot of addictions happen that way, unfortunately. And those with multiple medications naturally are at higher risk, because then they get really good at kind of manipulating the system to get what they want, because now they're addicted. And I've seen the system addict people and then abandon people. I've had patients where, they've come with legitimate, post-surgery, and, the doctor either was heavy-handed or light-handed. I've seen both scenarios. And, if the patient was not equipped properly pre-surgery, which many patients aren't, excuse me, And I've been on many cases where patients were not told their health status, their immune system status, and their body's ability to heal prior to surgeries. And so then going into surgeries, I've had them where they're like rushing to me, wanting to like patch them up. And I've done that. Or, they've come to me and, it's either too late or they can't afford, or, it's just a big leap for them to recognize, the harm that has been caused. There's a lot of denial. So I've really, again, seen the spectrum, and as these experiences float back into my mind, I'll share them because they're of importance. So roughly 12% of hospitalized patients experience iatrogenic harm, with 1 in 10 being serious cases, highlighting the need for improved safety precautions for sure. And just oversight. We need patient care advocates and just a lot of infrastructure that's not there. And also acceptance of what we do, as holistic providers. I think, it's really, really important. There's a lot to be said about global healthcare marginalizations with women. There's still a lot of violence going on, lots of high maternal mortality rates, specifically in different parts of Africa, gender-based, violence in various areas, lots of inadequate mental health infrastructure. We have that here in St. Lucia. Lots of criminalization stigmas that still exist within LGBTQIA, and that is global. Again, not specific to one area, but just global. So naturally, a lot of healthcare disparities, because if they're not recognized, they're definitely not able to access any sort of affirming healthcare or any sort of, just basic healthcare or, that sort of thing. So global health funding gaps as well. Naturally, lots of limits to where money is spent. And then the money that is spent is definitely suspect in terms of the intentions of why it's been spent in that way. So, and medical errors and all of that really goes back to a lot of the underfunding, overcrowding, or misdiagnosis, or lack of resources. I mean, there's just so much in the current healthcare system globally. And really just to drive it home that this has all been calculated. These colonial attitudes, I'm going to quote again from Medical Apartheid, the colonial attitudes towards health of non-white people have left a legacy of undervaluation and neglect. And so Washington explains that all of us, but specifically Black people, really, have been harmed by these U.S. medical institutions. And again, I know that I went over everyone, and medical apartheid really focuses on Black people. And I want that focus to be there because we're not seen. We're not seen. We're not heard. We're not accepted. Our voices are just not, they're drowned out. And so I recognize the marginalizations of other people, but I also recognize that if we really focus here on Black women and the marginalizations that have occurred with Black women, I also have another podcast, Respect Black Women. And, really if we find our voices and are able to be known, I really think that it can begin to make changes because we've continued to be undermined even in, current infrastructures, which we'll go over in the next segment. I just really wanted to ensure that we made space for other marginalized communities and that they felt like they were represented as well in the process of decolonizing their healthcare. So I had left off about how we specifically, and I'm going to frame it as Black women, we as Black women have been marginalized the greatest in the healthcare system. And the horrors of how our bodies have been used and continue to use it just absolutely saddens me. And then Black men, after that. And so, and Indigenous, and we can go on and on and on from there. But this colonial attitude really goes much deeper even than our modern culture. Imagine being ripped from our communities, our families, and then, our practices being demonized. And we can really see that all over our healthcare. That can be seen in even with the Catholic Church, with the monks, and, stripping them away of being able to use their herbs and telling them that they're not holy and all this stuff, but then they're doing the same thing. But as long as it's under the umbrella of the Catholic Church, it's fine. But if it's not, it's demonized. And it's the same kind of concept of, you're either for us or against us. And there's not a for or against when it comes to the health of a person. I have, you know, I've had what we call Hail Mary cases in my practice. And Hail Mary cases are patients that have been harmed by the healthcare system and do not trust the healthcare system, unfortunately have developed a aggressive disease process, like a tumor of sort, etc. And they need to navigate the conventional medical system, but the medical system has scared them and boxed them in so much that they literally just walk out and refuse treatment. And so eventually on their path, they find me and they want the Hail Mary. And they want me to tell them that, they'll, at this point, however long it takes them to find me, and however fast it's growing and whatnot, that I can just make it all go away. And I'm going to pull some, herb from some exotic country out from underneath my desk and give it to them and make it go away. Oh yeah. And I'm also, supposed to, wave my little wand and make sure that it happens on their time frame too. So there's just a lot of influence and pressure when we're talking about healing, healing comes from a very different space than management. When we're managing people's health, it's like whack-a-mole. When we are actually healing people and we're helping people transform, it's an awareness, it's an awakening, it's an expression, it's a freedom. It's a way of being. And that's why I teach my patients how it is to live a holistic lifestyle every single day. It's not just what you do. And sadly, the Rockefeller, Flexner, Carnegie powers of the world, have been the Gates, powers of the world have been allowed to kind of get away with this rhetoric and negate the actual facts and the truth, about how, these practices, including forced sterilizations, unethical experimentation, are really not isolated. They're actually part of a larger pattern, and that our distrust of the mainstream healthcare system is truly justified. And we should be allowed to question critically how our bodies are being treated. And those people that think otherwise, on both sides of the coin, because let's face it, I'm not for forced vaccinations. I'm also not for forced pro-life statutes. I'm not in that. My body, if I don't know, you can take everything, take it all. But my body, I came in this life with this baby. And so I'm been charged with maintaining it. I have invested a lot in my health. I have, literally all of my service records of years of medical health care that I have self-paid for to maintain my vehicle, my body. And so if I've carefully curated what goes in my body, what goes on my body, what goes around my body, who goes around my body, then why wouldn't I be able to scrutinize you in an open platform? And so, again, I don't have the protections of the powers that be. So it's easy to throw shade and it's easy to, you know, refute. But at the end of the day, I'm going to come with, again, facts, not feelings, historical as well as scientific information to really help you to chew on and understand. So, perfect. I think that we're going to end out here and move into, once we come back from our little break, we'll move into our last segment, which is just really what's moving forward, what we're going to be what I'm going to be recording and doing with this show and this platform in general. I will be going live as well, really just to teach you kind of in my everyday life how to have a holistic lifestyle. So check that out on live. And then I have other podcasts as well, not only Respect Black Women, but a health technology podcast that I'm really excited about to really show you how health data works and really the power of all of these principles working together that I'm going to teach you. So it's not just about the deep, dark past, although, if we don't understand the past, then we are going to doom to repeat it. But I also give you some practical solutions as well. So check out that show for a little more lighthearted topic subject matter. But for all those deep divers there, stay tuned for the next segment. All right, we're back. And so, wow, we've covered a lot of ground so far, and we will have a lot of ground that we're going to cover. But let's just kind of see, we're relaxing under the coconut tree, like for real. No, really, there's a coconut tree outside my house. I love it. Let's talk about, where we went to today. So we talked about exploitation, the colonial roots. We talked about how this affects Afro-Indigenous communities. We also talked about marginalization groups and how it affects that. We didn't talk so much about the systemic trauma, but we will definitely be going more into the systemic trauma. I'm sure you can understand if one generation has had these impacts and multi-generations. We have not even begun to heal really from the atrocities that exist. And unfortunately, some that are existing even to this day, which I never thought I would ever have seen the day that Roe v. Wade was overturned. And we are going to expand more into Big Pharma's role and how this profit-driven machine really motivates and contributes to health inequalities. Again, I am not an anti-pharmaceutical person. Pharmaceuticals have saved and helped many people's lives. It's just a matter of when and how it's being used, and it can't be used unchecked. And that's the problem, is that when you have these powers to be unchecked, they really just metastasize. And definitely, again, these autonomy and really helping you to understand. So for our future episodes, we're going to cover, in the next episode, we're going to go a little bit deeper into uncovering those colonial roots, exploring Western medicine dominance and suppression of non-Western practices. Then we'll get more into the exploitation in medical research in episode 3. Episode 4, we'll do a deep dive into intergenerational trauma and health disparities. And then episode 5, Big Pharma, profit over people. I'm sure you'll definitely want to tune into that one as we have a critical lens there. And then episode 6, we'll talk about a path forward, and we'll just continue building our roadmap on there. So definitely want you to consider how healthcare has impacted you up until this far. I'm sure you used it. Maybe you have, maybe you haven't. Some people haven't used it. I think, there's definitely a lot of pros to that, and there can be some cons too. So, I am a purist, but I'm an innovator, and I'm a believer in use what we have available, and let's let's throw it all on the table. Let's mix it all up. Let's grab a little bit of this and grab a little bit of that. I think some of the best recipes that I've made have literally been from just creative expression in the moment. And that's really how I've worked. And I have the freedom and flexibility to do that because I understand how the body works. And unfortunately, so many people don't know how the body works. And so they're not able to kind of have this lifelong experiment with themselves. I mean, I truly am always experimenting with myself and my health and really working on healing different parts of myself that are asking for attention. And so building the mind, the body, and the spiritual connection really is the journey in holistic medicine, and really is the journey in decolonizing your healthcare. It's about reclaiming you and what matters to you. And so I'm really excited to go on this journey with you guys and really bring to light so many just amazing stories. Please drop your comments. Please tag your videos. I definitely want to hear about them, and I want to include them in this show. So I don't want this to just be a monologue show as well. I definitely want to take some clips. So send these clips in, share your story on social media, on TikTok, all throughout. And that way I can respond. I love doing video comment responses. So. All right. Well, this concludes our first episode of Decolonizing Your Healthcare. I know this is going to be an amazing journey, one that is, going to require us to really look at ourselves in a deep, profound way. But I know a journey that will surely be rewarding at the end. So until next episode, take care.